Good afternoon. So today, at the end of the morning session, I'm talking on diabetes, how we should deal with this case because most of the diabetic patients sometimes feel hypoglycemia, and this is a time for them for lunch. So you most of them are already hungry. So I'll try to finish as early as possible. So I work in BIRDEM Hospital. BIRDEM stands for Bangladesh Institute of Research, Rehabilitation in Diabetes, Endocrine and Metabolic Disorder. So under the umbrella of Diabetic Association of Bangladesh, this BIRDEM Hospital started in 1956 by the initiation of the late national professor, Dr. Mohammad Ibrahim. His photograph is on the top of the building. He started in 1956, you see, so many years ago, and his foresight is so bright that he thought that diabetes is a multi-complicated disease and there should be more preventive measures, more treatment facilities because most of the diabetic patients not only suffer from one disease, they suffer from a lot of complications like kidney failure, heart failure, retinopathy, nephropathy, atherosclerosis, and whatnot. So his assumption started in 1956. And this is the biggest diabetic center in Southeast Asia. We have 100,000 diabetic patients registered in one hospital. And I started my dental department in 1986 and with full-fledged in 1987 with this, with myself only one dentist. Now we have different departments, different disciplines. We have prosthodontic departments, we have orthodontic department, we have maxillofacial surgery department, we have periodontal surgery department, all pediatric surgery department, all departments are there. And we have also started our dental college for undergraduate students. Every BDS students coming out from our institute every year with the BDS degree. So about 700 bed hospital and its campus in two places, both of which are equipped with all modern machinery and up-to-date facilities to provide services to patients of almost all disciplines, including diabetes and including dentistry. Though its academy, BIRDEM as a private institute, conducts the highest number of postgraduate medical courses in different subjects and is also being involved in various research activities in this institution as well as in cooperations with other national and international agencies and organizations. Now, talking about this hospital, BIRDEM through its OPD, outpatient department, provides services to patients of various disciplines, including diet and nutrition, dentistry, dermatology, physical medicine, rehabilitation, psychiatry, social welfare, facilitates for both outpatient and inpatients of both medicine and surgery. Endocrinology and metabolism, acute emergency medicine, gastrointestinal, hepatobiliary and pancreatic disorders, nephrology, including dialysis, neurology, critical care medicine, cardiology, respiratory medicine. We have also ophthalmology, ENT and head and neck surgery department, urology, hepatobiliary surgery, orthopedic surgery, and plastic surgery, including special foot care management. We have gynecology, obstetrics and pediatrics department of both diabetic and non-diabetic subjects with full-fledged SCABU and PICU services. World-class laboratories and the radiology and imaging departments with the latest technologies for investigations. So, when a diabetic patient comes to our hospital and registered as a diabetic patient, he never has to go anywhere. He gets all facilities in one department, in one hospital. So it's a one center care service center. This is a unique hospital in the world. And when I went to America World Diabetes Congress meeting, most of the Americans also said, if you want to say, see a diabetes center, how to develop, you please go to Bangladesh and see how they develop the diabetes center for the full care of the patient for lifelong treatment. You know, once the patient is registered in our hospital, they come lifelong. Every 3 months of monitoring their blood sugar and all the checkup. So it is a unique second, and I'm a proud dentist of this institute. So talking about the medical dental correlations, you know, the medical and dental correlation present in different ways. One is medical syndromes and treatments which can aggravate dental conditions. And another is dental problems which can complicate medical diagnosis and treatments. And the medical condition which alter the management and treatment plans of dental problems. So this is the both-way direction. So if there is a diabetic patient, the dentist should know about the medical conditions. And when the diabetic patient goes to a diabetologist, he should also know his dental conditions. So both cooperation and referral is very important. The how diabetes affects our oral health. Number one is reduced saliva, that is called dry mouth. Diabetes and some medications can decrease saliva production, leading to a dry mouth. Saliva normally washes away food, fights bacteria, and provides protective minerals. So less saliva increases the risks of cavities, infections, and other mouth problems. Number two is increased sugar in the saliva. High blood sugar can lead to higher glucose levels in the saliva, and which leads to harmful bacteria, and that causes caries. Now, the increased risk of gum disease. The combination of plaque buildup, inflammation, and reduced resistance to infection makes one more susceptible to periodontitis. So that's why diabetes, you know, the 5 complications in diabetes, the retinopathy, nephropathy, neuropathy, atherosclerosis, and the World Health Organization and the International Diabetes Federation now pointed out about the 6th complication, that is periodontal disease. Delayed healing. Diabetes can impair wound healing, and oral infection and issues like gum disease may take longer to heal. That's why the periodontal disease is never cured in diabetic patients because of the high sugar level. Increased risks of fungal infections. People with diabetes are more prone to fungal infections such as thrush, which cause painful white patches. These are some pictures in this slide. You can see the complication of cavity of the oral cavity in diabetes mellitus. These tongue abnormalities, oral infections, delayed wound healing, dental caries, taste abnormalities, oral lichen planus, gingival periodontitis, gingivitis and periodontitis, halitosis, that is bad breath, and salivary dysfunction. So all these complications happen in diabetic patients. Now, symptoms to watch for diabetes. So when a patient comes to a physician or a dentist, he should look into his mouth and see whether there is bleeding or swollen gum or receding gums. He should also look at the persistent bad breath or a bad taste in the mouth, loose or shifting teeth, dry mouth, burning sensation or excessive thirst, white patches on the tongue or inside cheeks, sign of oral thrush, and slow healing mouth sores. Now, high blood sugar adds stress to body and makes nearly every system work hard. These are bleeding, swollen or receding gums, persistent bad breath, loose or shifting teeth, dry mouth, burning sensation, white patches, as I mentioned earlier, and slow healing mouth ulcers. Now, how can diabetes affect saliva? Dry mouth or xerostomia occurs when a person's salivary gland do not produce enough saliva to keep the mouth moist. Xerostomia can be a symptom of diabetes. Diabetes can affect mouth by changing saliva. The fluid that keeps mouth wet, saliva helps prevent tooth decay by washing away pieces of food, preventing bacteria from growing and fighting the acids produced bacteria. Saliva also has minerals that help protect tissues in the mouth and fight tooth decay. Diabetes and some medicines used to treat diabetes can cause the salivary glands in the mouth to make less saliva. Diabetes can also increase the amount of glucose in the saliva. High levels of glucose in the blood can also cause glucose to build up in saliva. This glucose can lead to harmful bacteria that combine with the food to form a soft sticky film called plaque, which causes cavities. So these are the effects of the saliva due to diabetes, which causes so many diseases. Now about the bad breath. Most of the compounds that cause bad breath is hydrogen sulfide methyl, mercaptan, cadaverine, putrescine, scatolene. And these are the waste products of the anaerobic bacteria. More specifically, gram-negative anaerobes. These anaerobic bacteria grow best in environments that are devoid of oxygen. And that's why diabetic patient has got bad breath. Because of this anaerobic bacteria, this causes this kind of compounds which causes this halitosis. Now, how can diabetes affect saliva? Persons with non-insulin dependent diabetes are 3 times more likely to develop periodontal disease than non-diabetic individuals. Non-insulin dependent diabetes are 3 times more likely to develop periodontal disease. But when this combines with smoking, there is chances of developing periodontitis with loss of tooth supporting bone are 20 times higher. So this combination is very dangerous. When the diabetes patients smoke, the chances are 20 times higher. An increased risk for destructive periodontal disease for persons with insulin-dependent diabetes mellitus. So insulin-dependent patients are also in risk position. In addition to gum disease, diabetes also increases risks for other diseases. Tooth decay, dry mouth, oral infection, and slow healing. Oral health and overall health. Researchers have found that periodontitis is associated with other health problems such as cardiovascular disease, stroke, and bacterial pneumonia. Pregnant women who have periodontitis may be at increased risk for delivering preterm and low birth weight babies. People who smoke or use alcohol are at increased risk of developing periodontitis and a number of other health conditions, including oral cancer. So these are all risk factors living with diabetic patients if they are pregnant, and there will be much more complications, and the periodontal infection can also cause stroke and bacterial pneumonia as well as cardiovascular diseases. Now, the most important slide is all stages of periodontitis, even the advanced stages, may not always be associated with pain, bleeding, or other obvious symptoms and signs. It may look like normal. Similarly, sometimes diabetes may not always associate with excessive urination, thirst, or loss of weight. You never know who is who. So, diagnosis by blood test, looking at the fasting blood sugar level, or looking at 2 hours after breakfast, or investigating A1C level is more important for a diabetic patient. Maybe nowadays in science, medical science is talking about symptomless diabetes. Similarly, periodontitis may not be always present with bleeding gum, swollen gum, or bad breath. So this is why a thorough examination and the X-ray by a dentist is highly recommended. You can see the bone loss by the radiological examination. You can see the pocket depth by periodontal pocket depth. The periodontal pocket depth you can measure, which cannot be clinically seen. Now, American Academy of Periodontology mentioned that controlling your periodontal disease may help you control your diabetes. It is not only the insulin, it is not only the oral hypoglycemic agent, it is not only the diet control, it is not only the exercise that control diabetes. It is also the oral health, the periodontal disease. Therefore, diabetic patients should be sure both their medical and dental care provider are all aware of their medical history and periodontal status. So a full history of the patient and examination of the oral cavity is very, very important for diabetes management. Here you can see this slide shows periodontitis is a chronic inflammatory condition induced by pathogenic biofilm that accumulates on tooth gram-negative bacteria. Porphyromonas gingivalis is Ternelia, Forsythia, and Treponema denticola has suggested to be the primarily causative agent in periodontitis. Cytokines cause chemoattraction of neutrophils with an attachment of ROS production and NFB and AP1 activate osteoclast resulting in tissue damage. So these are the all mechanisms that are going on in diabetic patients causing to periodontal infection. So as mentioned earlier by our two speakers, Professor Pritinder Singh and Professor Christopher Turner, I agree with you that it is a two-way passage. And yes, diabetes and periodontal disease are considered comorbidities because they have a bidirectional and two-way relationship where each condition can worsen the other and they share common pathological mechanisms like inflammation and oxidative stress. Poorly controlled diabetic patients respond differently to the bacterial plaque at the gum line than well-controlled diabetic patients. And similarly, poorly controlled patients with diabetes also have more harmful proteins in their gum tissue, causing destructive inflammation of the gums. Some of the mechanisms that explain the increased pathology seen in diabetic patients as a result of periodontal infection, these are mainly three conditions: altered vascular physiology. Number one is reduced immune response. Number two, particularly protective response by neutrophils. And number three, it is reduced ability for tissues to heal. Internal findings for diabetes. As mentioned earlier, mostly, these are all like dry mouth, burning mouth, gingival proliferation, gingivitis, periodontitis, abnormal wound healing, multiple carious lesions, genital albicans, denture sore mouth, angular cheilitis, median rhomboid glossitis, periodontal abscess, acetone breath. This bad breath is sometimes known as acetone breath. Increased salivary viscosity, asymptomatic parotid gland swelling. These are also findings. A number of conditions of the oral mucosa may present as white patches. Although the majority of white patches are of little significance, certain lesions are associated with pre-malignancy or malignancy. So when a diabetic patient comes with a white lesion, oral ulcer, it should be given importance. Some of the lesions are precancerous, like leukoplakia. If the oral lesions persist for more than 3 weeks, we always recommend for biopsy. But unfortunately, one of the poster I think you have presented yesterday about the oral cancer phobia, and the patients are never go to the dentist or they give less importance to this kind of lesion. Sometimes they think these are lack of vitamins, so they take some kind of vitamins. Maybe they think it will heal up. It's not that kind. But in diabetic patient, this kind of ulcer is very dangerous. So one should give importance to this kind of ulcer, white lesions. Once they come, they should be examined clinically and give more importance to the biopsy and see whether it is malignant or benign. Now talking about the diabetes and smoking. Older smokers with diabetes are much more likely to need insulin than who do not smoke. Because some of the people take insulin and smoker needs more insulin. The dose of the insulin is much more needed for these patients. People with diabetes are 3 times more likely to have heart attack if they smoke. So smoking is a dangerous risk factor for all diabetic patients. In our center in BIRDEM Hospital in Dhaka, Bangladesh, when a patient is registered and all the history is taken, and he from the private or personal history, we got the message that he is a tobacco user, whether it is a smoking or non-smoking tobacco. In Bangladesh, most of the people take non-smoking tobacco. This is called jorda. They take with the pan. This is more, taste, they get more, flavor. So that's why they take it. And this is our traditional culture. They take jorda with pan. So this is very dangerous. Smoking and non-smoking tobacco. Diabetes and tooth loss, 1 in 5 cases. Yes.
Does the government work against smoking?
Yeah.
Do they have programs like we in Holland have?
Yeah.
Is it in Bangladesh?
Bangladesh, we have already, according to the FCTC, Framework on Tobacco Control, that the decision has made in the Geneva by 200 health ministers in one sitting. The tobacco control law should be implemented in all countries, and we have already implemented, and our law enforcement agency are doing all these measures. Public place, no smoking in our country. If they smoke, there is a penalty. There is no advertisement. There is no sponsoring. So all these things are going on. Regular dental visits. Regular dental visits are crucial for detecting issues early. A dentist can spot signs of gum disease, tooth decay, or other oral health problems that may be linked to diabetes. The earlier these issues are addressed, the easier they are to manage. So when our patient come to diabetes center as a diabetes, they are referred to our dental department. It is our discipline, it is our routine. They are referred to eye department, whether they have got retinopathy. They are referred to dental, whether they have got periodontal disease. So management is very easy in our hospital. Smoking and diabetes, as I mentioned, as you know, chemical compounds in a cigarette. In a cigarette smoke, there are 7,357 estimated number of chemical compounds in cigarette smoke. Toxic products. These are all toxic. 7,357. And among them, 70 are carcinogenic. Number of these compounds with confirmed carcinogenic activity. That's why they have got oral cancer. That's why they have got lung cancer. Individuals who smoke have a 30 to 40% higher chance of developing diabetes than someone who never smoked. It is the study, there is many studies has been done, and it is found when the young boy starts at the 16 or 17 years or 15 years, they start smoking. By getting at the age of 35 or 40, they become diabetic. So it is not only the family history, it is not only the obesity, it is not only the overweight, but cigarette smoking also causes diabetes. It leads to diabetes. This is the current research one. Smoking can be a direct cause of type 2 diabetes, and the more cigarettes you smoke, the higher it is. It is, if you take 1 or 2 cigarettes per day, it takes maybe long time. But if a young man started cigarette 10 packs a day, his chances is much more to be diabetic in near future. With type 1 diabetes, smoking can make the condition harder to control because smoking can change how your body processes and regulates sugar. Tobacco and diabetes, a dangerous combination that causes increased blood sugar. Smoking raises blood sugar levels, making diabetes harder to control. Insulin resistance. Tobacco use can lead to insulin resistance, worsening diabetes management. Quitting smoking improves your health and diabetes control. Protect yourself and your loved ones. This is the slogan that we have made in our hospital. So we have a department for counseling tobacco user patients. We have a psychiatrist and we have a psychologist who is doing this kind of work. They also refer this patient to the psychiatric department, and they are doing the counseling. So until the patient is not quitting the tobacco, his treatment is postponed, and he get the clearance from the psychological department that he quitted, and we also follow up these patients. He comes regularly whether he's taking, but they become benefited by this kind of treatment. Because smoking is the addiction. If a doctor said don't smoke, if you smoke, your sugar will never recover, that will not work. But this addiction should be treated like a drug addiction patients, like a drug abuse patient, drug addicted patient, because they are addicted to smoking. So it's one kind of addiction, they need treatment. This is the poster that I like most. This poster is given by WHO, World Health Organization, 1984, World No Tobacco Day. This shows that how tobacco harms the human body. You see, top to bottom, all the organs of the body are affected by tobacco. You see the hair loss, number 1. Number 2, cataracts, that is retinopathy. Number 3, wrinkling. Number 4, hearing loss. Number 5, skin cancer. Number 6, tooth decay. Number 7, emphysema. Number 8, osteoporosis. Number 9, heart disease. Number 10, stomach ulcers. Number 11, discolored fingers. Number 2, uterine cancer and miscarriage. Number 13, deformed sperm. Number 14, psoriasis. Number 15, Barger's disease. And last of all, 16 is cancer. So I made this poster in my chamber in the department. And when a smoker comes, I show this. And I asked him, take your mobile picture, take this picture. And he will look at this picture every day. And that works psychologically, you know. They get fear of it, they get panic of it, and that works. That's why cigarette packet nowadays in different countries, you see the picture of heart disease, picture of oral cancer, and now it is recommended in many countries according to tobacco control law. In Australia, this full packet is pictorial warning, this oral cancer. You see you go to Australia and see the cigarette packet. In Canada, even many countries, they have introduced. Because this works. When the smoker takes the packet from the pocket and see the cancer, he psychologically affects. He thinks, oh my God, it might affect me also. So I should stop it. So gradually it works and we quit. So this is another, the non-smoking tobacco. In our country, is very much popular in the rural areas. The female diabetic patient, female persons take more with this pan and jorda. That is called jorda, pan bahar, and so many things. So this is very delicious. They take it traditionally, and this is also cause for oral cancer. And we have also our counseling section also doing all this work for them. There is many paper already published about the smokeless tobacco associated with the increased risks of type 2 diabetes. It results from 5-fold core studies. So a lot of studies are coming up in the medicine and surgery, in the medical science, that are showing that non-smoking tobacco also causes diabetes, not only the smoking. This oral cancer patient came to my department 15 years ago, and he was biopsy and found to be squamous cell carcinoma grade 2. Then he went to India, Tata Memorial Center, which is the biggest cancer hospital in India, and his tongue was operated. He cannot speak now. So this is the condition for the tobacco user, so dangerous. And this is the example of one example of this. Cause as well as effect smoking and diabetes. Number one, in the past 15 years or so, evidence has accumulated which suggests an association between cigarette smoking and the risks of developing type 2 diabetes in both men and women. Studies were large, prospective, population-based, and convincing. Number two, these researchers found that among people who smoked 40 cigarettes or more per day, men had a 45% higher risk of developing diabetes than men who had never smoked. The comparable increased risk for women was 74%. So you see the risk, the percentage of risk is so high. Almost identical results in men were presented from Toothfen study, the health professionals follow-up study, the physician health study, and the British Regional Heart Study, and the Women in the Nurses Health Study. So all studies combined and shows the same result. So in our hospital, we maintain this 3-4-A formula. Number one is ask about smoking at every opportunity. If a patient comes, you should ask, are you a smoker? Are you using tobacco? Number two, advise all smokers to stop. The message should be go directly to the patient that this is not good for you, this is harmful. Your diabetes will never be controlled, and there is more risk of cancer and other diseases. Number three is assist the smoker to stop. Not only say just stop, but you should assist and give him a date. Like example, I say, what is your birthday? He said, in November 13th, my birthday. Okay, you go for smoking until November 13th. And on the day of your birthday, when you take the cake at your house and your wife and children will come to celebrate your birthday, you declare, it's a good news today. I am quitting smoking from now. So everybody will kiss you. So this is the way, you know, when there is a commitment in front of the family members, a commitment is very important. Then he keep the commitment in future. Number four is arrange follow-up visit. Not only do this, but let him come every month or 3 months after, whether he is quitting or not, whether any disturbance, whether he needs any medication, whether he needs any counseling. So we should help them. Diabetes management. A systematic review and meta-analysis confirm that scaling and route planning effectively reduce HbA1c levels and C-reactive protein in patients with diabetes, type 2 diabetes. You know, these two blood tests is very important. Before any dental surgery, we not only go for fasting blood sugar or 2 hours after blood sugar, we ask for HbA1c, which indicates that his average blood sugar for the last 3 months. That indicates whether the patient is a good patient or a bad patient. If the HbA1c level is always bad, then we should do more, we should refer the patient to a endocrinologist for better management. And we should also see C-reactive protein CRP, which is an indicator of many infections. Good dental health is vital for people with diabetes. High blood sugar increases the risk of gum disease, tooth decay, infections, and these oral health problems can worsen diabetes control and lead to other serious health issues. Management of diabetes with a healthy diet. We have also dietitian in our hospital. When a diabetic patient comes, they are referred to dietitian. So, giving his height, weight, and age, they make a diet chart. So every diabetic patient got the diet chart from the dietitian. How, when, what they eat, what not to eat. Regular dental visits, diligent home care, brushing and flossing, and informing dentists about diabetes are crucial for maintaining oral health and managing your overall condition. Why oral health matters? Taking good care of the mouth is important to overall health and well-being. It is not only for the diabetic patient, but all patients. Good oral health habits can help prevent pain and infection from tooth and gum disease. High blood sugar can weaken white blood cells. These are body's main way to fight infections that can occur in the mouth. How often should diabetic patients visit the dentist? Most people should see the dentist twice a year. But with diabetes, dentists may recommend more frequent visits, potentially every 3 to 4 months, to prevent and monitor gum disease progression. There was a slogan once upon a time in America that birthday once a year, a dentist twice a year. That is a very good, slogan. Birthday once a year, dentist twice a year. Now the scientists are recommending not twice a year, but 3 to 4 times because more complications are. Our lifestyle is changing. You see the whole world taking the fast food, giving order in the online, that is coming to our house, KFC, BFC, all the soft drinks, and they make them more heavyweight, overweight. That causes diabetes more complicated. So these lifestyle changes causes all these things. How can I keep my mouth healthy? Keep your mouth healthy. NIHS external link, that's by taking the steps. They say, keep your blood glucose numbers within your target range. Your doctor can help you set your target and explain what to do if your numbers are too high or too low. When a patient takes the insulin, when they see in a glucometer, his blood sugar is 14 millimole per liter, he can increase that insulin dose to maybe he's taking 40 units, he can make it 60 units. This is the counseling that our doctor does. So he can do it himself. Consume healthy meals and beverages and follow the meal plan you and your doctor registered dietitian have worked out. What I'm talking about, the dietitian, they made a diet chart. So they should follow this. Visit your dentist regularly. Ask your dentist how to take care of your teeth at home, including the cleaning tools and products you should use. Your dentist can recommend a cleaning routine tailored to your needs. Dental management in diabetic patients. In patients with controlled diabetes, no special treatment is required. For routine dentistry, including prophylaxis and dental restorative care, the patient should be told to continue with their normal eating and injection regimen. Morning appointments are recommended because cortisol levels are highest at this time and will provide the best blood glucose level. When we do the dental surgery or any intervention, we always ask the patient to come in the morning because it's the best time for surgical intervention. The morning meal should not be skipped. He should not come fasting. Likewise, the type 1 patient should not be scheduled immediately after an insulin injection because this may result in a hypoglycemic episode. Now, medical dental correlations, coming to our ending session slides. Medical dental correlation present in different ways. Number one, medical syndromes and treatments which can aggravate dental conditions. Number two, dental problems which can complicate medical diagnosis and treatments. And number three, medical conditions which alter the management and treatment plans of dental problems. So our dental patient, when we get something complication or diabetes uncontrolled, we always call our endocrinologist, diabetologist, and refer the patient to go there and get a good management. They come back and we look at the result and then we start. Without consultation, without referring, we do not do any work. Treat the teeth. We always talk to our diabetic patients about the importance of getting an eye exam, a foot exam, and a kidney test. But we also need to make sure that they are going to the dentist. This is very important. Until there is pain, nobody goes to a dentist. This is a normal phenomenon. But we should motivate them, make the awareness system so that they can visit regularly. Normally, people get their teeth cleaned twice a year, but people with diabetes and poor oral health might need to get their teeth cleaned every 6 months. Tips for people with diabetes. Now, there are 5 tips. One is control your blood sugar. Keep your blood glucose level in the target range to lower your risk of complications. Number 2, practice good oral hygiene. Brush your teeth at least twice a day with right toothpaste and floss daily. We not only ask the patient to brush only, but we also ask for floss. Visit your dentist regularly, get professional cleaning and checkups every 6 to 12 months or as recommended. Inform your dentist, tell your dentist you have diabetes so they can provide appropriate care and advice. Quit smoking. Smoking significantly increases the risk for gum disease and can make more worsen condition. These 10 tips in fact will help you to maintain good dental health. I have already mentioned about this. And last of all, I want to say, dentist is no longer treating teeth in patient, but rather patient who have teeth. Does it make sense? Dentists are not only treating teeth, but the patients who have teeth. So we take all the history of the patient, taking care of the diabetes and other disease, then we go for dental treatment. Conclusion, oral complication in patients with other systemic disease are considered major complications of this disease and can impress the patient quality of life. There is evidence that chronic and persistent oral complication in this patient adversely affect blood glucose control and their management. Thus, prevention and management of oral complications due to other diseases are considerable. Close collaboration between the medical and dental team can positively benefit the population through early diagnosis and management of the oral complication of the diabetes. Thank you for your patience here.